Welcome back everyone. This is case number 12 of MSK series. This case is a 20-year-old patient presented with hard lump in right hand for 6 months duration. So this is the anteroposterior radiograph of the right hand in a skated immature patient. So here you can see the obvious abnormality. So the almost entire fourth metacarpal bone is affected. So there's a well-defined lytic lesion involving the fourth metacarpal in the diaphysis, metaphysis, and epiphysis. So it has some soap bubble appearance like this, multilobulated, and however, still you can see the cortex fairly okay, and it has narrow sonor transition. So the articular surface fairly okay, proximal and distal articular surfaces. Cortical breach is not there, so it's a one benign feature. No cortical breach. And also no soft tissue component. And no periosteal reaction. So these are features of a benign lesion. There are no fractures and no synchronous lesions elsewhere. And so the diagnosis of this lesion is aneurysmal bone cyst. It's a relatively uncommon site for aneurysmal bone cyst. For the differential diagnosis, giant cell tumor and enchondroma. However, there are no matrix calcifications to suggest enchondroma. Giant cell is a good differential diagnosis. If it is there in a long bone, then we have to think of other differential diagnosis like fibrous dysplasia and non-ossifying fibroma. Last one, simple bone cyst. So these lesions, aneurysmal bone cyst lesions, usually they origin at the metaphysis and extend to epiphysis. Simple bone cyst origin at the metaphysis and extends to diaphysis. So it's a one differentiating feature, and it is common in the first and second decade of life. And so it's a benign lesion. It can be associated with other lesions like giant cell chondromyxoid fibroma, fibrous dysplasia, non-ossifying fibromas. So you call those things secondary ABC. So these are the basic things about aneurysmal bone cyst. So the common sites are proximal tibia, proximal femur, proximal humerus, sometimes posterior elements of vertebra. So one unique feature for ABC is fluid levels in MRI. So it's a one cardinal feature of ABC. So that concludes the case number 12. Please subscribe our YouTube channel, then you can get notifications of our case videos, and you can give comments for our videos. Thank you everyone.